Hi, this is Shane Hostensky in Adult Health 4 Didactic. This is for our discussion question, Module 1 in Professor Crawford's class. Now today I have decided to talk about diabetic ketoacidosis. Now, diabetic ketoacidosis is a serious complication of diabetes. It most often occurs as a complication in diabetes type 1 and only very rarely in type 2 diabetes. The reason DKA is so rare in type 2 diabetes is because insulin is still regulating. The complication that often occurs in diabetes type 2 is hyperosmolar hyperglycemic state, which can be relatively similar and present similar symptoms to diabetic ketoacidosis, or better known as DKA. Now, diabetic ketoacidosis occurs as a type of metabolic acidosis, meaning the pH will often be below 7.35 and the HCO3 bicarbonate will be lower than 22, putting both the pH and bicarbonate in an acidotic state. This condition arises when the body doesn't have enough insulin to enable blood sugar into the cells and be utilized as energy. Due to this, the liver then starts to break down fats for fuel known as ketones, which are acidic. When too many of these ketones are produced at too fast of a rate, this causes our blood to become too acidic. The main symptoms of DKA are being very thirsty, urinating frequently, nausea, feeling of needing to vomit, shortness of breath, fruity scented breath, and being confused. The blood sugar level in ketoacidosis is often a level of 300 milligrams per deciliter or greater. A key difference in DKA as compared to HHS is that HHS, the blood sugar will be more extreme at around 600 milligrams per deciliter or higher. And also ketones will be present in DKA as in HHS they will not be. Potassium levels will show a false reading of hyperkalemia due to the extracellular shift of potassium leaving the cells. However, DKA patients often lose 3 to 5 MEq per kilogram of potassium due to constant loss of potassium in those fluids being excreted. Key contributing causes to diabetic ketoacidosis is poor management of type 1 diabetes. Not controlling blood sugar levels can also lead to severe complication of diabetic ketoacidosis. An illness can also play a factor, causing hormones like adrenaline and cortisol to become affected and work against the effects of insulin. Pneumonia and urinary tract infections are the most common illnesses that can lead to DKA. Some other factors that can lead to DKA are physical or emotional trauma, heart attack or stroke, pancreatitis, pregnancy, alcohol, or drug use. Certain medications such as corticosteroids or some diuretics. Now, main treatment options for diabetic ketoacidosis are isotonic fluids for dehydration, electrolytes such as potassium to replenish potassium, and insulin to bring blood sugar levels down, and also glucose. So we bring those levels down and they land softly. In treatment, like I just mentioned, a soft landing is vital, so administering fluids with dextrose may be applied so the blood sugar does not crash from insulin administration. Important ways to prevent diabetic ketoacidosis from even occurring in the first place is to manage one's diabetes. This is very important as not managing diabetes can lead to diabetic ketoacidosis and many other problems as well. This can be done by monitoring blood sugar consistently, taking appropriate insulin, maintaining a healthy diet, and incorporating exercise into weekly routines. And that's all. Thank you.